So for copy and recall therapy, also known as CART, treatment is ideal for non-fluent aphasia patients, but is not limited by the severity of their aphasia. Therapy can be used for patients of any age, with any number of years since the onset of aphasia. Therapy may be easier for patients who still have use of their dominant hand, but is not limited by that factor. Education and prior writing abilities may not be a factor in determining their performance, and patients can perform well without these prerequisites if they are motivated. Motivation is a huge factor in their success, and patients who don't complete their homework don't improve as quickly as those patients who do. Patients who are more independent may be more motivated to improve as well.
The stimuli used for CART therapy is selected by the client with aphasia, their spouse, children, communication partners, and in conjunction with the clinician. The initial word sets for each client contain 20 words, which are divided into sets of 5 words each. Only one target set is addressed in each particular session. Words are represented with line drawings or with pictures of the words that are meaningful to the client. Worksheets are used in therapy, and the worksheets contain pictures as well as lines in which the client can copy their target words. If a client makes any spelling mistakes, the clinician will provide a handwritten version of the target word, but only when necessary. A session using CART therapy will begin by using a set of 5 pictures next to a set of 5 lines. Each of these pictures will represent a meaningful word to the client, and the clinician will begin by asking the client, "House. Can you write the word house?" If the client is able to correctly write the word house, the clinician will move on to the next target word. However, if the client is not able to correctly write the target word, the clinician will present a handwritten model of that word, house. The clinician will then ask the participant to copy the word by saying something like, "It looks like this. Can you copy it?" The clinician will ask the client to copy the word 3 times. Once the word has been copied 3 times, the clinician will remove all written examples of the word and will ask the client to write the word again by showing them the picture and asking them to fill in the word house. If the client is able to complete this task, you can move on to the next term. Once all 5 words have been addressed in the session, the clinician will assign homework to the patient. Homework is presented using the same 5 words and giving 20 lines per word. The client will be asked to write each word 20 times per day for 6 days of the week. At the end of the week, the clients will test their recall by writing words 1 time without using any visual cues. It's good to see you again, Georgette. How are you?
Fine, thanks.
How was your weekend?
Fine, thanks.
Well, what did you do? It's okay, Georgette. We're going to try something new in therapy today. We're going to try something called copy and recall therapy. Is that all right with you?
Yes.
Perfect. I've got some pictures with me, and we're just going to try and write the words on them. So this one is phone. Can I have you write phone for me? That was close. I'm going to go ahead and write it over here so that we can see the differences in the spelling. You see how we have a PH in our phone and this E at the end? Can I have you write phone 3 more times for me? That was very good. I'm going to take away this paper so you can't see the word anymore. And I want you to write phone again for me. Can you write phone on here 3 times? Perfect. I think you're ready to move on to the next word. So I'm going to take away this. I'm going to give you the word book. Can I have you write book for me? Perfect. B-O-O-K. Let's try the word travel. Can I have you write travel for me? Oh, it looks like you wrote the word trip on here. We're going to try this one more time on this paper, and I'm going to write it out for you. So we'll go T-R-A-V-E-L. Can I have you write travel for me 3 more times? Perfect. And just like with the last word, I'm going to take away the visual cues, and I need you to write travel again for me. It looks like we're still seeing the word trip here, but that's okay. We're just going to wait on that one. We'll work on it again later. Is that okay?
Yeah.
We're almost out of time, so I'm going to show you what your homework is going to be. Here you'll see our same words, and next to them are 20 lines. So every day I want you to write the word 20 times. So you'll go house, house, house 20 times, book, book, book 20 times. When you're done doing lines for all 5 words, I want you to test yourself. So before you come to session next week, I want you to look at each of these pictures and write out each of these words without looking at any visual hints. Does that sound okay?
Yes.
Perfect. Have a good week, Georgette.
Thank you.